Welcome back to the deep dive. You know, we often find ourselves swimming in this huge sea of solutions, especially for something personal like, well, hair health.
Oh, absolutely. It's tough sometimes to figure out what's just flashy marketing and what's actually, a real breakthrough.
Exactly. So today, that's our mission. We're going to unpack two really distinct and honestly pretty fascinating approaches.
We're looking at SH-1, which comes from Sovereign Diagnostics,
hmm
and then PP405 from Pelage Pharmaceuticals. Very different players.
And the core of this, what makes it so interesting, is this kind of clash of paradigms. It really feels like that.
Mm,
You've got SH1, which is based on, get this, simulation-based receptor inhibition.
sounds complex.
Right. And then on the other side, PP405, which is all about regenerative stem cell activation.
Two fundamentally different ways of thinking about the same problem, basically. How do you get healthier hair or keep the hair you have?
But this isn't just about hair loss treatments.
Not at all. I think understanding these two gives you a great lens for looking at, well, any kind of solution out there.
Like, how do you evaluate things? Does it rely more on sort of a big story and narrative?
Yeah, or is it all about the hard science, the clinical data?
Yeah.
And maybe, just maybe, can they work together?
Ooh, interesting thought. Could these opposites actually, like, combine into something bigger?
That's the really exciting question here, I think. It's a journey into science, maybe a bit of philosophy, and even how stories shape our perception.
Okay, let's start with SH1, Sovereign Diagnostics. This one definitely has a unique feel to it.
It does. So the basic mechanism, scientifically speaking, is DHT receptor blockade.
Okay, break that down. DHT blocker.
Right. So DHT, dihydrotestosterone, is a hormone often linked to hair loss, specifically follicle miniaturization. SH1 uses a non-steroidal antagonist. Think of it like putting the wrong key in the lock.
So the real DHT key can't get in and cause problems.
Exactly. It physically blocks the receptor site, stopping DHT from shrinking the hair follicle. That's the claim.
And the evidence they show, what's backing this up?
Well, what Sovereign Diagnostics provides are these simulation visuals, which look quite compelling, and also competitive binding curves data suggesting SH1 does indeed bind to that receptor.
And it's promoted by Dr. Melvin Sewell.
Yes, which adds a layer of authority. But here's the key thing.
Uh-oh.
There are no peer-reviewed clinical trials cited specifically for SH1 itself.
Okay, so that immediately tells us it's playing a different game than, say, a prescription drug.
Precisely. And that leads straight into this idea of the diagnostic simulation aesthetic.
Right, it's not just about the molecule, it's the whole presentation.
It's very visually driven, and it's framed almost mythically.
Yeah.
It fits right into Sovereign Diagnostics' bigger picture, their multiversal ethos.
Multiversal ethos. Okay, that sounds like more than just biotech.
Oh, it is. This isn't just a cream or a serum. It's tied into their whole narrative world. Concepts like the sovereign drift.
Sovereign drift, like a philosophical journey.
Kind of, yeah. And Echo Rift 9X, which sounds like some legendary event in their lore. It all connects back to a character arc, too, Psychovenga. It's deep storytelling.
So the product itself becomes part of this larger story, a mythic reclamation of vitality, as they put it.
Exactly. Which makes you wonder, is its real power less as a direct medical cure and more as a, let's say, metaphorical or experiential diagnostic?
Meaning it helps you engage with their world, understand yourself within that narrative.
Potentially, yeah. It has symbolic weight within that specific context.
That makes its strategic value really interesting then. It's maybe not just about selling a product, but enhancing an entire experience.
Right. Think about it. SH1 could be positioned as a piece of a larger diagnostic framework.
Like maybe it's a symbolic item you use within their TrueFlow tournament. That sounds like some kind of challenge or game.
Or part of an Echo Rift curriculum, maybe guiding you through their philosophy.
Yeah.
It becomes a narrative tool, a way to deepen engagement with their whole ecosystem.
And this links back to the lack of clinical trials, doesn't it? The regulatory side.
It does. Because if it's marketed as a cosmetic topical, and crucially, if it avoids making explicit medical claims.
It can skip the long, expensive clinical trial process.
Correct. It can potentially get to market faster, relying on how it looks, how it feels, and whether consumers feel it's working for them.
So it's not just a cosmetic, it's this diagnostic artifact. It carries that mythic and experiential weight you mentioned.
That's the identity they seem to be building for it. It operates in a slightly different space than a traditional medical treatment.
Okay, let's completely shift gears now. Let's talk PP405 from Pelage Pharmaceutical.
Right. If SH1 is myth and experience,
PP405 feels like straight-up clinical science.
Very much so.
Yeah.
The mechanism here is totally different. Stem cell activation.
Stem cells. Okay, that sounds potentially huge.
It is. It works through metabolic and genetic pathways, and the goal is really ambitious, to reactivate dormant hair follicle stem cells.
So not just protecting what's there, but actually waking up follicles that have stopped producing hair.
That's the idea. Regeneration. A biological restart for those follicles.
And the evidence here, I'm guessing it looks different from SH-1s.
Oh, completely. We're talking preclinical studies, a completed phase 1 safety trial, and they're currently in a phase 2A trial, which looks at efficacy.
So the standard pharmaceutical development pathway, rigorous testing.
Exactly. And look at the backing. Over $30 million in funding, including from Google Ventures. Plus, strong research ties to UCLA.
Okay, that's serious investment, serious scientific pedigree, very different vibe from the multiversal ethos.
Totally different. This isn't the diagnostic simulation aesthetic. PP405 is positioned as a scientific revolution.
Grounded firmly in regenerative medicine.
Yes, focused on a biologically integrative approach and aiming for measurable outcomes, hard data, clinical results.
The narrative is simpler, maybe, less poetic, as the notes say, but more empirical.
Precisely. It's about proving through rigorous science that it can do what it claims. And if those phase 2A results are positive,
If they confirm that regenerative potential,
it really could redefine the whole field. Imagine actually reactivating dormant follicles on a large scale. That's a game changer.
so when you put them side by side, the contrast in credibility and potential scale is pretty stark right now.
It is. As a standalone biomedical solution, PP405 definitely seems to have the edge currently. It's on that recognized path towards becoming a potential medical treatment.
But this brings us back to that earlier thought. Does it have to be either?
Right. That's the brilliant insight, I think. Instead of seeing SH1 versus PP405, what if they're not competitors? What if they're collaborators?
Okay, now I'm intrigued. A synergistic approach. How would that even work?
Well, think about their mechanisms. SH1 is the blocker, the defender.
The guardian, protecting the existing follicles from DHT.
Exactly. And PP405 is the regenerator, the rebuilder.
But you mentioned earlier PP405 would be vulnerable to DHT itself unless it was protected.
You got it. So SH1 could provide that essential protection. It shields the follicle, creating a safer environment.
And then PP405 comes in to do the heavy lifting of reactivating the dormant stem cells.
Precisely. SH1 holds the line. PP405 builds anew. It covers both defense and offense, so to speak.
That actually makes a lot of sense biologically. And how would you use them?
You could imagine SH1 being, say, a daily topical. Keep that DHT shield up consistently.
Okay.
And PP405 maybe as a more potent treatment, perhaps used in cycles, like a weekly or monthly application to really kickstart that regeneration.
A comprehensive protocol, protection and growth.
Exactly. And think about the narrative potential of that combination.
Oh, yeah. SH1 isn't just a blocker anymore. It's the, what was it? The Sovereign Drift artifact, the Mythic shield.
Right. It keeps its cool narrative power, but gains a clear functional role in the combined system.
And PP405 is Pellage's scientific spear, the cellular rebirth. Science meets myth.
It's like that archetypal pairing they mentioned, Naira Vex, the containment architect.
Protecting the system.
And Vathar Rageborn, the regenerative catalyst, driving renewal. Containment and renewal working together. It's a powerful story and a potentially powerful treatment.
This completely reframes how you could think about SH1, doesn't it?
It really does. If it's part of this dual system, it's not just a standalone cosmetic fighting for credibility against clinical drugs.
It becomes a cosmetic diagnostic enhancer. Its role is clear. Its value is amplified by being part of that bigger solution.
And imagine the marketing. SH1 could be sold as that daily ritual for sovereign vitality.
Tapping into the existing brand narrative.
Maybe even integrated into those AR or VR simulations they seem keen on. You apply the SH1 shield to your avatar, track your follicular health. It blends the physical, digital, and mythic.
Wow, that's quite a vision. Creating this whole immersive experience around hair health.
And the ultimate product could be this mythic dual kit.
The Sovereign Protocol, Shield and Seed. I like it.
Right. It takes these two very different philosophies and weaves them into one, potentially much stronger offering. Protection and growth, myth and science.
Okay, so let's recap for everyone listening. We've journeyed through SH1 with its unique diagnostic mythic approach, lots of narrative, maybe less clinical data.
And contrasted that with PP405, all about regenerative science, clinical rigor, measurable results, but maybe less poetic.
But the real kicker, the exciting part, is how they might actually work together.
That synergy. SH-1 protecting, PP405 regenerating, creating a potentially more comprehensive protocol than either could offer alone.
And like we said at the start, this isn't just about hair. It's a fantastic case study in how different ways of thinking storytelling versus empirical data drive innovation.
How they shape products, how they're marketed, and how sometimes the most powerful solutions might come from blending those seemingly opposite approaches.
It really makes you think about how we evaluate things, doesn't it? The power of a good story versus the power of hard evidence.
Absolutely. Which leads us to our final thought for you to chew on.
How might this blend, this combination of mythic resonance and clinical rigor, pop up in other areas, not just biotech?
Could that diagnostic aesthetic, framing things within a compelling story, actually make complex science more engaging, even if the core is purely empirical?
Or is there a risk? Does that powerful narrative sometimes distract from the need for solid proof? Where's the right balance?
What does it take to capture our imagination and deliver real, measurable results? Something to think about.